Hello, ladies and gentlemen. My name is Carlton D'Souza. This is Million Opinions. And in today's episode, we have Dr. Puneet Wadhwa, a child pediatrician specialist who has over 2 decades of experience in the UAE, Dubai. And he's here to share his expertise with us. Dr. Puneet, welcome to Million Opinions.
Hi, Carlton. Hi. Thanks for having me here today on Million Opinions.
So, Doctor, why pediatrics?
To be true, actually, it was mainly because my father is a physician. He's a general physician. And my grandfather also was a Ayurvedic physician, a Hakim. So in erstwhile Pakistan, like before migration, he was practicing there. Then when they migrated to India after partition, then he continued his practice in India. And later on, my father took over, and from my father to me. Yeah, so it was just like a natural thing, and I never thought that I could do anything else since my childhood.
So this was a calling, or was it your parents wanted you to be?
Of course, you can say like they wanted to me to be this only, and but to be true, when I looked around, I also could not find anything specific which I had a special interest in. So since my childhood, I was seeing them practicing and visiting their clinic.
That brought that.
Yeah, so I was okay with that. I liked it actually. So and later on, after doing graduation, then it was about the choosing the branch and all. So that also pediatrics somehow I liked in my MBBS. So that's how I got into it.
Can we speak about the milestone of a child?
They start from birth itself.
Mm-hmm.
So generally the first year is very important because you can see almost 15-20 days or almost every month something new will be coming up in a child. At birth, generally the child will not be able to see properly. He can see, but it's very faint. The vision is very faint, and there is not much as far as milestone thing is concerned. And the child may smile in the sleep. So as we go ahead by 1.5 months, 1 month, then the child starts to recognize mother's voice, and by 1.5 to 2 months, they will smile also. That's called social smile. Like if somebody is trying to make them smile, and they will smile back. Then there are, it's a continuum. At a specific age, after 3 months, 4 months, they start holding their neck, and they are more awake. Before 3 months, they are almost asleep and feeding. There's nothing else they do. So then later, the major milestones will be like sitting. That comes around 5-6 months with support. At 7 to 9 months without support. And then after sitting without support, they start standing with support. Later again, standing without support. And then walking, which comes around anywhere in between 11 months to 18 months. That's how what we call the gross motor milestones.
Right.
Then there are the fine motor milestones. Fine motor milestones are more about our fine movements of our hands, our fingers, like how the child will grasp something. So newborn has a grasp reflex. Like whenever you put a finger on their palm, on anybody's palm, they will try to grasp your finger. That's a natural newborn reflex which is present since birth. Then slowly they can, after 6 months, they can move their hands. They can look at their hands and try to bring them while lying down. They will try to bring 2 hands in the midline and see, That is again a very important milestone. Later on at 9 to 12 months, they start picking the objects. Finally, before that, they can crudely pick any object. Whatever you give them, they will grasp it and try to mouth it. After 6 months, there is mouthing. And at 9 months, they can, grasp it. It is called pincer grasp. That's a very fine form of grasp, and that is the time when they are ready to have some finger foods. Like if you give, say, a very soft French fry or something, there is a baby biscuit, so they can hold it after 9 months. So this is roughly about the fine motor milestone. Then there are other social and language milestones. Language-wise, they make some sounds at cooing. We call it cooing. These are pleasurable sounds, or they just want to try to talk, but it is not comprehensible. That will start at 3 to 4 months. Then by 6 months, they start babbling, ma, ba, la, like that. And after 8, 9 months or 10 months, they can say mama, papa sometimes, and sometimes it's up to 1 year. And after 1 year, the language progresses very fast, between 1 to 1.5 years, and from 1.5 to 2 years, they have a addition of almost 50 to 100 words. So, and by 3 years, they are almost as good as other children, but of course, it's not very clear. But at 3 years, they can understand everything. Most of the thing they can understand, and they can speak most of the things, but it is not very in articulation thing, or you can say pronunciation is not so accurate. And by 4 to 5 years, the speech is it's fully developed. So this is about the general, about the milestone. There are some social milestones which will start with toilet training, Toilet training starts after around 2 years, 1.5 to 2 years. Between 1.5 to 2 years also, some children, they will point to the toilet needs. They can, if they want to pee or poo, you can make out, okay, they are making some different expressions. And by 2 years, they are trainable. That's why the most of the nursery schools, they will start, for children, we can send them after 2 to 2.5 years. That is the age in which they are fit to go.
Now, say, for example, the first few days of life, what are the most important things to do, like vitamin D drops and exposure to the sun?
For first few days of life, if a child is on exclusive breastfeeding, then we need to supplement the vitamin D. Yeah. Vitamin D drops, generally, most of the children are born in hospitals and are well taken care of by doctors. So vitamin D is prescribed as a routine. Other things which are done at newborn birth is injection of vitamin K. And there are 2 vaccines, hepatitis B and BCG. This is the birth thing. And one more, you asked about specifically about...
So let's go about vaccines first. Yeah. These are at birth, and then the types of vaccines and the intervals of vaccines, if you could let us know.
Yeah, so in the vaccine, generally till 1.5 to 2 years, vaccines are more vaccine. We can say that they are frequent. Visits are frequent for the vaccines. After that, they become a bit less. So we start with birth, then it is at 2 months, 4 months, 6 months. Then there are some vaccine. After 6 months, it's at 9 months and 12 months. Then again, it is at 15 to 18 months. After 18 months, there is a good gap actually, 6 months or 1 year gap between the vaccines. The details, of course, there are a lot of schedules. And UAE national schedule is different. And in this country, we find people from many nationalities. So some have shifted in between. So you have to just modify their schedule according to UAE schedule.
The pooping, doctor, for babies, how often they poop? Or if they don't poop regularly, what is the safe number of days that they can go without pooping?
Yeah, that's a very frequent question which comes along. See, actually in newborns, there is no specific frequency. Of course, the first poop after the birth, it should be within 48 hours. Yeah, that's medically very important, because if a child does not poop within first 2 days of life, and then it can signify some serious medical conditions. So once the baby is at home after discharge, then generally poop is variable actually. We can say it can be once in 5 days, or it can be 5 times in 1 day. Okay. So there is no specific frequency, but it has been seen as a general thing, children who are more breastfed, they will poop less frequently.
And why is that?
There is no specific reason for that, because it is a natural food and it is well digested, and actually there is no particular science behind that.
Right.
Yeah.
Right. Okay. But that's just an observation.
Yeah, that's an observation. And with the formula feeds, the children will pass more frequent and bulky stools,
Okay.
But up to 4-5 days is normal in the newborn period. And up to 3 months, 4 months, that's the normal. Even if a child is not passing, even once in 5 days is okay. But the poop should be soft. That's more important. Then after 6 months, when we start weaning, when we start giving some liquid solids to the child, Then of course the poop character of the poop changes, the frequency changes, and there are many other changes. So that keeps on happening, and it's very important to introduce proper solids and water at that time after 6 months. Otherwise, there is constipation. Huh? If a poop is hard, even for 1 day or 2 days, that will be called as constipation after 6 months.
Mhm.
Poop should be soft all the time. That's more important than the frequency.
So, doctor, when, say, for example, after 6 months, we wean the child off milk, and
Yeah.
then we start introducing other kind of foods. What is the how thick should it be, or should it be, what kind of texture should it have?
Yeah, so for initially when we start at 5 to 6 months, we start the weaning. So it has to be with liquids, like any chicken soup, only the water part. Or if you are making lentils or beans, just the soup of that, or a vegetable soup. So once a child is used to the liquid, then slowly you go on to solids. Initially there are no teeth, so and the child will not chew. So it has to be totally pasted, It has to be pureed. It can be in a blender that you can do. And as the child grows by and child starts having teeth and some chewing movements, you will come to see, like, if a child is trying to chew and they have teeth also, that time we should not grind it fully. We should make it coarse grind or start leaving some soft pieces in the food on which the child can bite upon. That's how we go. And once after 1.5 2 years, that is the time when child will have all the teeth and they have good chewing movements, then we can start soft solids.
What about the type of food that we give? You always suggest to give something that the family is used to eating, no?
Yeah.
Or do we? Is it advisable to give something exotic to the child?
Not really, actually, because in child, actually, taste buds are they are well formed after 6 months, 7 months. So whatever you give initially, they may not accept. They will you can say, they will try to resist. So of course, the only thing which is important is not to introduce sugar or salt initially, because that can be addictive, and they will not. If we start sugar or putting too much salt in the food, then they may not like other foods. Now coming to the exotic things, yeah, there are ready-made foods and exotic, pureed fruits, vegetable. They are available, commercial ones, and there some of them are natural also without preservative. They are good actually. Of course, if parents cannot find time to make foods at home and make special food for the baby, they can use that. But generally, the food which we are making for adults, if we don't put spices in it initially and just in a boiled form, we can give, most of them are good to go for the children. Generally, I tell to start with fruits and vegetables in mashed form, and then they can go to some grains or lentils, beans or rice. And then later we can introduce chicken, fish, or other food, non-vegetarian food, egg also, yeah.
Doctor, the shape of the head of the child. Sometimes the shape is not symmetrical.
True, that's true.
So, does one have to be worried about that?
Yes and no. In that, there is no one answer that, okay, of course it depends. I mean, some children may be having it may be a serious issue or it may be trivial. Most of the time it is positional. We call it positional plagiocephaly, because now most of the doctors will tell, to make the child lie on the back, and initially 3 to 6 months when child is on the back and they cannot move much. They cannot roll, they cannot move. So generally there is flattening, in one side or other side, and the head seems asymmetrical because the skull bones, actually, our skull is made of 4 to 5 bones, and they are joined by sutures. So, and initially you must have noticed there is a soft space also in the skull. And what happens is, because the child's brain has to grow initially in the first 2 years, it has to grow very rapidly. So that is to make some space for that. After 1.5 to 2 years, the skull becomes one bone after the fusion. So initially the skull gets a little deformed very easily, especially when child is on their back for the full day. And After 3 to 6 months, when they start making some movement, they start holding their neck, and sometimes they are sitting also, then naturally it goes away. It is called positional plagiocephaly. But of course, if there is a concern, it should be checked by a pediatrician, because there are some conditions, like there is one serious condition called craniosynostosis. In that, what happens, as I told, like there are 4 or 5 bones which are joined by sutures. In some cases, like in cases of craniosynostosis, those suture lines are not there, and all the bones are already fused, and there is no space for the skull to grow, and it can hamper the brain growth also, head growth also, and it requires a surgical treatment. So that's why to identify that condition, it's very important to get it checked if you have concerns about the head shape. Sometimes it's like moderate cases are moderate to severe. Then in that cases, helmet is required. That is started after 4 to 6 months. The helmet will be having a projection on one side so that the other side gets flat, and the helmet therapy helps. But most of the children, around 80%, they don't require any treatment for that, and naturally the shape becomes normal with age.
The child falling sick at early stages, like 3 months, 6 months. When I say sick, I mean the common cold, or
Yeah.
the older sibling is sick. Then, what can we give to the child?
Again, it's we cannot quantify. Again, in one line, I cannot give an answer
No,
to
not at
that.
all. Yeah,
It depends on the age of the child. Like for the protocol wise, if we see any child of less than 3 months, if they get fever, then they had to be, they should get a checkup done by a pediatrician, because it's very important. It can have a serious reason. But of course, if a child is more than 3 months, 6 months like that, and any other family member is sick, and child is not having fever, only cold or cough, then 1 or 2 days they can wait also. Like you can give over the counter some medication, or maybe like with consultation of a doctor. And of course, if fever is there, and especially the high grade fever, like more than a 101 or 102 degree Fahrenheit, then child needs to be seen immediately. Otherwise, for general coughs and colds, if child is more than 6 months, we can wait for 1 or 2 days, especially if it's without fever.